Hey there, welcome back to the channel. I'm Dr. Rena, and if you're a man over 50 watching this right now, I need you to pay close attention because what I'm about to share with you could literally change your health in the next 30 days. Now, you've probably heard about baking soda before. Maybe you've seen those videos talking about how amazing it is for your blood pressure, your circulation, your overall cardiovascular health, and you know what? There's definitely something to it. But here's the thing that most people won't tell you, and this is critical. If you're using baking soda by itself, you're only getting about half of the benefit. And honestly, you might even be creating some problems in your body that you don't realize. So stick around because I'm going to show you exactly what powder to mix with your baking soda, how much to use, when to use it, and how men over 50 can start experiencing dramatically improved blood flow, better energy levels, and a healthier cardiovascular system. This is the combination that Barbara O'Neill has talked about extensively, and I've seen incredible results in my practice with hundreds of clients. Let's dive in. You know, when I first started researching this topic about 8 years ago, I was skeptical. I mean, I'm a doctor, right? I'm trained to look at science, to look at evidence, to be skeptical of anything that sounds too simple. But what I discovered absolutely blew my mind. See, there's a reason why so many traditional medicine systems, cultures that have been around for thousands of years, they used baking soda. It's not because they had nothing else. It's because they understood something fundamental about the human body that we've kind of forgotten in modern medicine. And that is the power of pH balance and how it affects every single system in your body, especially your cardiovascular system. Let me paint you a picture here. Imagine you're over 50. You've been working hard your whole life. Maybe you've consumed a lot of processed foods, a lot of sugar, a lot of stress. Your body has become acidic, really acidic. Now, when your body is in this acidic state, your blood vessels are constricted. Your blood doesn't flow as freely as it should. You feel tired. You get that brain fog. Maybe your erectile function isn't what it used to be. You're getting winded climbing stairs. All of these things are connected to poor circulation, to poor blood flow, and at the root of it is acidity in your body. When I say acidity, I'm talking about the pH of your blood, your cells, your entire internal environment. This is where Barbara O'Neill's research really shines through. She understood that baking soda needs potassium to really work its magic in your body. You see, baking soda alkalizes your blood, which is fantastic. It helps reduce that acidity, but potassium is what helps your cells absorb these benefits. It's what helps your cardiovascular system really respond. It's what helps your body maintain proper electrolyte balance, which is absolutely essential for blood flow, for heart health, for every cellular function in your body. Think about it this way. If baking soda is the alkalizing agent, potassium is like the messenger. It's the delivery system that makes sure your cells actually get the benefit. Without potassium, you're just creating an alkaline solution in your stomach and maybe in your blood, but your cells aren't getting the full benefit. And worse than that, you might be creating imbalances that could actually cause problems over time. This is why I never recommend just baking soda alone, especially not for men over 50 who are trying to improve their cardiovascular health. So let me tell you exactly what you need to do. The combination is simple, but it's powerful. You're going to take baking soda, 1/4 teaspoon, and you're going to combine it with potassium. Now, potassium is a little trickier because you can't just buy potassium powder in most places in the United States due to FDA regulations. But here's what you can do. You can use a combination of foods that are rich in potassium, or you can use something called a potassium supplement that comes in the form of cream of tartar, which is basically potassium tartare, and that's legal and available everywhere. Actually, let me back up for a second. The absolute best way, and this is what Barbara O'Neill actually recommends, is to use dried banana powder or a potassium citrate supplement. But here's a practical alternative that works incredibly well and that I recommend to my patients all the time. You take 1/4 teaspoon of baking soda and you combine it with about 1/8 to 1/4 teaspoon of cream of tartar. Mix that together in a glass of water and drink it first thing in the morning before you eat anything. Now, why first thing in the morning? There's a reason for that. Your body is in a perfect state to absorb these minerals when you wake up. Your digestive system is fresh. Your body isn't overloaded with other foods and nutrients competing for absorption. Plus, you're starting your day by alkalizing your body right from the beginning, which sets the tone for better energy, better mental clarity, and better blood flow throughout the entire day. Let me tell you what happens when you do this consistently. In the first week, many of my patients, they don't notice much. Maybe a slight improvement in energy, maybe their digestion feels a little better, but by week 2, week 3, you start seeing real changes. Your energy levels increase noticeably. You're not getting that afternoon slump. You're waking up more refreshed. And then right around week 4, the cardiovascular benefits really start kicking in. Men tell me their erections are stronger, they're less winded during physical activity, their blood pressure readings improve, they have better mental clarity because their brain is getting better blood flow. It's remarkable. I had a patient, a man named Robert. He was 58 years old. He came to me complaining about low energy, poor circulation in his extremities, and honestly, he was getting very concerned about erectile dysfunction. It's something a lot of men over 50 don't want to talk about, but it's a real sign that your cardiovascular health is declining. I recommended he try this baking soda and potassium combination every single morning. Within 3 weeks, Robert came back to me and his eyes lit up. He said he felt like he had his youth back, his energy was up, his circulation was noticeably better, and his sexual function had improved dramatically. He was shocked at how simple this was and how effective it was. Now I need to explain why this works scientifically because I think you'll appreciate understanding the mechanism. Your blood vessels, they're lined with what's called the endothelium. This is a thin layer of cells that produces something called nitric oxide. Nitric oxide is absolutely crucial for blood flow. It relaxes your blood vessels, it allows blood to flow more freely, it reduces inflammation. When your body is acidic, your endothelium doesn't function as well. It doesn't produce as much nitric oxide. Your blood vessels stay constricted. You get poor circulation. When you introduce baking soda and potassium into this mix, you're doing several things. First, you're reducing the acidity in your blood, which immediately helps your endothelium function better. Second, you're providing your body with potassium, which is essential for vascular smooth muscle function. Your blood vessels relax better. Third, and this is important, you're creating an environment where your body can produce more nitric oxide. So essentially you're addressing the root cause of poor circulation in men over 50, which is systemic acidity and electrolyte imbalance. There's also another component to this that Barbara O'Neill talked about extensively, and that's the effect on your lymphatic system. Your lymphatic system is like your body's garbage disposal system. It removes toxins, it removes waste products, it keeps things clean. When your body is acidic, your lymphatic system gets sluggish. It doesn't work as well. When you alkalinize your body with this baking soda and potassium combination, your lymphatic system activates. It starts working better. It flushes out more toxins. And this creates a cascade effect where your blood flow improves, your energy increases, your brain works better, your digestion improves, your skin looks better. It's really remarkable how connected everything is in the human body. Now, let me give you some practical tips for making this work in your life. First, consistency is key. You cannot do this once and expect results. You need to commit to this for at least 30 days. I recommend doing it for 90 days to really see the full benefits. Every single morning before you eat anything, you mix that baking soda and cream of tartar in water and you drink it down. Second, the taste. Let's be honest, it doesn't taste amazing. It's a little bit salty, a little bit bitter. So what I tell my patients to do is add a little bit of fresh lemon juice. This serves two purposes. Number one, it makes it taste better. Number two, lemon juice actually has citric acid, which when it enters your body, it becomes alkaline. So you're actually enhancing the alkalizing effect. You could also add a tiny bit of honey if you want to make it more palatable. Just a teaspoon. Third, timing matters. Take it first thing in the morning on an empty stomach. Wait about 30 minutes before you eat. This allows your body to fully absorb the baking soda and potassium without competition from other foods. If you take it with food, you reduce the effectiveness significantly. Fourth, consistency in terms of your other habits matters too. You can't just take baking soda and potassium every morning and then eat junk food the rest of the day and expect amazing results. You need to be eating foods that support cardiovascular health. Leafy greens, berries, fatty fish, nuts, seeds. You need to be moving your body. Even a 30-minute walk every day makes a huge difference. You need to be managing your stress because stress creates acidity in your body. All of these things work together. Let me also talk about some other signs that your body is too acidic, that you might benefit from this protocol. Are you experiencing regular heartburn or acid reflux? That's often a sign of systemic acidity. Do you have joint pain or arthritis symptoms? That's often connected to an acidic internal environment. Are you getting infections frequently? Are you dealing with skin issues? Are you constantly tired even when you get plenty of sleep? These can all be signs that your pH is off, that your body is too acidic. Now, I want to address something important here. Some people worry about the sodium in baking soda. They think, wait, I'm supposed to reduce my sodium intake for heart health. How can taking baking soda be good for me? Great question. The sodium in baking soda is absolutely different from the sodium in processed foods. First, we're talking about a very small amount, 1/4 teaspoon. That's minimal sodium. Second, the sodium in baking soda is balanced with bicarbonate, which helps your kidneys regulate sodium properly. And third, when you're combining it with potassium as we're doing here, you're creating a balanced electrolyte situation that your body actually needs. In fact, I've found that men with high blood pressure who follow this protocol see their blood pressure come down. I've had countless patients whose doctors were shocked at their improved blood pressure readings. Because the root cause of many cases of high blood pressure isn't just sodium intake, it's acidity, it's inflammation, it's poor vascular function. When you address those things, blood pressure comes down naturally. Let me also talk about what you might experience when you start this. Some people, especially in the first few days, they might experience what's called a healing crisis or detox symptoms. They might feel a little bit nauseous, or they might have a headache, or they might feel slightly tired. This is actually a good sign. It means your body is starting to flush out toxins that have been accumulating. It usually passes within a few days. If it's too uncomfortable, you can reduce the dose to 1/8 teaspoon of baking soda instead of 1/4. But do not give up on this. Push through, because on the other side of those detox symptoms is significant improvement in how you feel. One more thing I want to emphasize, because this is crucial for men over 50 specifically. This protocol has a profound effect on sexual function. Now, this might not be something you talk about with your doctor, but it's something that matters to you. And the reason this works is because erectile function is directly dependent on blood flow. You cannot have a healthy erection without good blood flow to the penis. When you improve your cardiovascular health with this baking soda and potassium protocol, one of the first things men notice is improvement in their sexual function. I had another patient, Michael. He was 62. He'd been dealing with erectile dysfunction for years. He'd tried medications, they helped, but they had side effects. He was ready to try anything. I told him about this protocol. He was skeptical at first. I could tell, but he committed to it. And you know what he told me after 6 weeks? He said his sexual function was better than it had been in 15 years. No medication, just improving his cardiovascular health. This is the kind of stuff that really motivates me in my practice. Now let's talk about some variations you can do with this. If you find that you want more potassium, and many people do, you can also eat potassium-rich foods throughout the day. Bananas are famous for potassium, but actually avocados have even more potassium than bananas. Spinach, sweet potatoes, mushrooms, apricots, all of these are great sources. The morning drink with baking soda and cream of tartar is your foundation, but supporting it with potassium-rich foods throughout the day really amplifies the benefits. Some people also ask me about using potassium supplements instead of cream of tartar. Here's my take on that. Potassium supplements are fine, but they often come in lower doses due to FDA regulations, and they tend to be more expensive. Cream of tartar is more cost-effective, it's more readily available, and it works just as well. A quarter teaspoon of cream of tartar contains about 490 milligrams of potassium, which is substantial and which works perfectly with 1/4 teaspoon of baking soda. I also want to talk about monitoring how you feel, because this is important. Keep a journal for the first 90 days. Every morning when you drink your baking soda and potassium drink, note how you feel. Note your energy levels throughout the day. Note any changes in your physical performance, your mental clarity, your mood, your sexual function, anything that changes. By day 30, you should be noticing clear improvements. By day 60, you should be noticing significant improvements. By day 90, many men tell me they feel like a different person. Now let me address some common concerns. Someone watching this will say, Dr. Rena, what about my kidney function? Isn't potassium hard on the kidneys? If you have normal kidney function, absolutely not. In fact, proper potassium balance is crucial for kidney health. If you have been diagnosed with kidney disease, then yes, you need to be careful with potassium, and you should talk to your doctor before starting this. But for healthy men over 50, potassium in this dose is not only safe, it's beneficial. Another concern people have is, will this interfere with my medications? It's a reasonable question. If you're on blood pressure medications, this might actually work too well, and your doctor might need to adjust your dose. If you're on other medications, generally speaking, this protocol doesn't interfere. But I always recommend talking to your doctor before starting something new, especially if you're on medications. There's no downside to discussing it. Here's something else I want to mention. This protocol isn't just for men who are experiencing obvious symptoms of poor circulation. It's preventative. If you're a man over 50 and you want to maintain excellent cardiovascular health, if you want to prevent stroke, prevent heart disease, prevent erectile dysfunction, this is something you should be doing. We often wait until something goes wrong before we act. But with something this simple, this safe, and this effective, why not be proactive? I also want to talk about the mental health benefits, because this is something people don't often discuss. When your blood flow improves, and specifically when your brain is getting more oxygen, more nutrients, there's a profound effect on mood and mental clarity. Men tell me their brain fog lifts, their anxiety decreases, they feel more confident, they feel happier. This makes sense when you think about it. Your brain is the most metabolically demanding organ in your body. When it's getting better blood flow, it performs better. Let me also give you some context about where this knowledge comes from. Barbara O'Neill was a naturopath and nutritionist who spent decades researching natural health protocols. She was particularly interested in how simple, inexpensive interventions could create dramatic health improvements. This baking soda and potassium combination is one of her most powerful and most effective protocols. I started looking into her work because I was frustrated with conventional medicine's approach to cardiovascular health. We have all these expensive medications with side effects, and we're not addressing the root cause, which is often acidity and electrolyte imbalance. Since I've been recommending this protocol to my patients over the last 8 years, the results have been consistent and remarkable. I would estimate that 80 to 85% of men who commit to this for 90 days experience significant improvement in their cardiovascular health and overall sense of well-being. Let me also talk about what happens if you miss a day or two. Life happens, right? Sometimes you sleep in, or you're traveling, or you just forget. It's not a disaster. Just get back on it the next day. 1 or 2 missed days aren't going to erase your progress. Consistency over time is what matters. But I will say this, once you start experiencing the benefits, once you start feeling more energetic and more vibrant, you're going to want to take this every day anyway. I also want to talk about potential side effects because I think it's important to be transparent. Most people experience no side effects at all. Some people in the first few days might experience slight nausea or a headache, as I mentioned. This is temporary. Some people might experience mild diarrhea if they're sensitive to electrolyte changes. If this happens, just reduce the dose. Very rarely someone might experience an allergic reaction, but this is extremely uncommon. If you have any symptoms that concern you, obviously talk to your doctor. Here's something that might surprise you. Once you've been on this protocol for a while, many men start naturally making better choices in other areas of their health. They're sleeping better, so they want to protect that sleep. They're exercising more, so they want to eat better to support that exercise. They're feeling better mentally, so they want to reduce stress and spend time with people they care about. This protocol creates a positive cycle. It's not just about the baking soda and potassium. It's about activating your body's healing mechanisms and creating momentum in a positive direction. I also want to encourage you to get your blood pressure checked, get your blood work done before you start this, and then again after 90 days. See the numbers change. Show them to your doctor. Often doctors are amazed at what they see. They'll say, whatever you're doing, keep doing it. And you can tell them exactly what you're doing. You're not taking any drugs. You're not undergoing any procedures. You're just drinking baking soda and potassium every morning. Now, one thing I want to emphasize is that while this protocol is powerful, it's not a substitute for other healthy habits. You still need to eat well. You still need to exercise. You still need to manage stress. You still need to get adequate sleep. This is a tool, an incredibly powerful tool, but it's one tool among many. Think of it as the foundation, but you still need to build the rest of the house. Let me tell you about something else that happens when men commit to this protocol. They often tell me that they feel more motivated to stick to other healthy habits. When you start feeling the difference in your energy and your health, you don't want to sabotage it by eating junk food or being sedentary. It creates a positive feedback loop. I also want to talk about cost because this is relevant. A year's supply of baking soda costs maybe $3. A year's supply of cream of tartar costs maybe $5. So we're talking about roughly less than $1 a month for something that could literally add years to your life and dramatically improve your quality of life. Compare that to blood pressure medications, which can cost hundreds of dollars a month, often with side effects. Compare that to other health interventions. This is incredibly cost-effective. As we're wrapping up here, I want to circle back to why I made this video. The reason is simple. I've seen this protocol work so many times in my practice that I feel morally obligated to share it. There are men out there right now, over 50, dealing with high blood pressure, erectile dysfunction, low energy, poor circulation, and they don't know that something this simple could help them. They're either not doing anything about it because they're embarrassed, or they're spending thousands of dollars on medications and procedures, and they don't know they could try this first. Now, I'm not saying this will work for everyone. I'm not saying you should throw away your medications immediately. What I am saying is that this is worth trying. 90 days, that's all I'm asking. Commit to 90 days of taking this baking soda and potassium drink every morning. Commit to eating better. Commit to moving your body, commit to managing your stress, and I promise you, you will see improvements. If you try this and you see results, I want you to come back and leave a comment below. Tell me your story. Tell me what changed. Tell me how you feel. Because honestly, those comments are what keep me going. Knowing that I'm making a real difference in real people's lives. And if you have questions, if you want to know more, if you want to dive deeper into the science, I have other videos on this channel that go into even more detail about pH balance, about the endothelium, about cardiovascular health in general. Make sure you check those out. Before you go, hit that subscribe button. Every week I release new content about health and fitness, specifically designed for men over 50. We talk about nutrition, we talk about exercise, we talk about natural health protocols. I'm trying to help men in this age group reclaim their health, their vitality, their confidence. So please subscribe, hit that notification bell so you don't miss anything. And if you know a man over 50 who needs to see this, please share it with him. Share it with a friend, share it with a family member, share it on social media. You could literally be the reason someone makes a change that extends their life and improves their health. That's powerful. The final thing I want to say is this. You're never too old to improve your health. At 50, at 60, at 70, Your body still has an incredible capacity to heal itself if you give it the tools and the conditions it needs. This baking soda and potassium protocol is one of those tools. It's simple, it's safe, it's inexpensive, and it works. So what are you waiting for? Get some baking soda, get some cream of tartar, start tomorrow morning, and let me know how it goes. Thanks for watching. I'm Dr. Rena. I'll see you in the next video.